Morphine is a powerful opioid analgesic commonly used for pain management. Its pharmacology involves interacting with the body's opioid receptors. Here are some key points. 1. Mechanism of action. Morphine primarily acts on the mu-opioid receptors in the central nervous system. This activation leads to a decrease in the perception of pain and can induce a sense of euphoria. 2. Analgesic effects. Morphine's primary therapeutic use is for pain relief, particularly in cases of severe pain, such as post-surgical pain or cancer-related pain. 3. Metabolism. The liver metabolizes morphine into various active and inactive metabolites. Genetic factors can influence how an individual metabolizes morphine, affecting its efficacy and side effects. Oral immediate-release morphine. For adults with moderate to severe pain, the initial dose is typically 10 to 30 milligrams every 4 to 6 hours, as needed. For elderly or opioid-naive patients, lower initial doses, such as 5 to 15 milligrams, may be recommended. Oral extended-release morphine. Extended-release morphine is used for around-the-clock pain control. Initial doses for opioid-tolerant adults may range from 30 milligrams to 100 milligrams every 12 to 24 hours. Morphine can be found in several different forms, including oral tablets and capsules, oral solutions, injectable solutions, suppositories, transdermal patches, liquid concentrates, extended-release formulations. Morphine, like other opioids, can cause a range of side effects. The most common side effects of morphine include 1. Constipation. Opioids, including morphine, can slow down the digestive system, leading to constipation. This side effect is very common and often requires treatment with laxatives. 2. Nausea and vomiting. Morphine frequently causes nausea, which may be severe. This side effect can sometimes lead to vomiting. 3. Drowsiness and sedation. Many people experience drowsiness or a feeling of sedation when taking morphine. This effect can impair a person's ability to perform tasks that require focus and attention. 4. Dizziness. Morphine can cause dizziness or lightheadedness, which may increase the risk of falls or accidents. 5. Itching and rash. Some individuals may develop itching or a rash as a side effect of morphine. 6. Respiratory depression. Although less common, morphine can slow down a person's breathing, especially at higher doses or in cases of overdose. This is a serious side effect and requires immediate medical attention. 7. Euphoria. While not a side effect in the medical sense, morphine can produce a sense of euphoria or well-being. This effect is what makes opioids, including morphine, potentially addictive. 8. Tolerance and dependence. With prolonged use, the body can develop tolerance to morphine, meaning that higher doses are needed to achieve the same level of pain relief. Additionally, physical dependence can develop, leading to withdrawal symptoms if the medication is discontinued abruptly. 9. Urinary retention. Morphine can sometimes cause difficulty in passing urine. Morphine can interact with various medications and substances, potentially leading to adverse effects or reduced efficacy. Some common interactions of morphine include 1. Other central nervous system CNS depressants. Combining morphine with other CNS depressants, such as benzodiazepines, other opioids, or alcohol, can increase the risk of severe respiratory depression, sedation, and overdose. It is essential to use caution and follow a healthcare provider's instructions when using multiple CNS depressants simultaneously. 2. Antidepressants. Certain types of antidepressants, particularly monoamine oxidase inhibitors MAOIs, can interact with morphine and lead to serious reactions, such as serotonin syndrome. It's crucial to inform your healthcare provider of any antidepressants you are taking. 3. Antipsychotic medications. Some antipsychotic drugs can increase the risk of respiratory depression when combined with Morphine. Healthcare providers should monitor patients closely when using these medications together. 4. Anticholinergic medications. Medications with anticholinergic effects, e.g., some antihistamines. Antispasmodics can exacerbate morphine's constipating effects. 5. Medications that affect liver enzymes. Drugs that affect liver enzymes, particularly those that inhibit the CYP3A4 enzyme, can alter the metabolism of morphine, potentially leading to increased blood levels and side effects. Conversely, inducers of CYP3A4 may reduce the effectiveness of morphine. 6. Serotonergic medications. Combining morphine with serotonergic drugs, e.g., selective serotonin reuptake inhibitors or SSRIs, can increase the risk of serotonin syndrome, a potentially life-threatening condition characterized by agitation, confusion, rapid heartbeat, and more. 7. Medications for hypotension. Morphine can lower blood pressure, so combining it with medications used to treat low blood pressure, e.g., antihypertensives, may lead to excessive blood pressure reduction. 8. Anticoagulants. Morphine can increase the risk of bleeding when used with anticoagulant medications, such as warfarin or heparin. Close monitoring of clotting parameters may be necessary. 9. Medications for gastrointestinal disorders. Some medications used to treat gastrointestinal disorders can interact with morphine, potentially affecting its absorption or efficacy. 10. Herbal supplements. St. John's wort and other herbal supplements can affect morphine metabolism and should be used cautiously.